Alright! And Ian Trottier for Discussions of Truth. That is Metallica Seek and Destroy. Why do I intro with that? Because I aim to seek out and destroy corruption on all levels. Okay, so the United States. We've got some very interesting things happening. Protests over lockdowns across the land. Various interpretations of the origin of the COVID-19 pandemic. It is killing people, yes. I believe the UK has now overtaken Italy in number of deaths, and my understanding is the United States has most deaths out of any country globally. So interesting how two of the most developed countries globally. Certainly, I don't know that there is a currency that surpasses the value of the pound sterling. Certainly, the US dollar doesn't come close to it. But I think the dollar might be more valuable than the euro. Not sure. Those two are fairly neck and neck. Last time I checked. Ian Trottier here again, broadcasting and reporting. Yep, not a reporter and certainly not a journalist. I am simply a voice that gets out there for you to hear the research that I've done. Why? Because I was exposed to the Zika pesticide a number of years ago, now about 3.5, coming up on 4 years ago in Miami Beach. And it was the research that I found that really was mind-boggling. You can type it into your web browser, Zika Miami Beach, Trottier. It'll bring up the honey colony article, and that's Trottier. And that'll tell you exactly why I do what I do. Freedom Reserved, No More Lies, Trying Day publication. Due to release in July. That's been pushed back 3 months due to this pandemic, I believe. You can get it, pre-order it at Barnes & Noble and on Amazon. If you're in Canada, Chapters, Indigo. It's available in the UK, Australia, Denmark. So there are a number of online outlets you can find it at. And that is basically a compilation of the first couple years of research that I did. Go to iantrottier.com, click on the articles tab, and that will give you a list of probably 100 links, close to it, my guess, 70, of no cost to you, PDF, typically PDF format, available literature, documentation that tells you, gives you perspectives, research of other authors, typically politicians, high academic, Stanford, be it Anthony Sutton, to give you a further understanding of why I do what I do. Anthony Sutton gave a speech at Miami Beach in 1972. He revealed information. It was a political speech. He wasn't a politician, just simply a researcher. He revealed information that got him into hot water. When he returned back to Palo Alto, he left the institution within a year, my understanding, and started publishing on his own. So what was he revealing that those strings above him did not want him to be revealing? That is the same element of control that you're looking at in regards to Sutton's research that you would identify with as being your Federal Reserve. So the first question, by the way, we're bringing on J.P. Linstroth here momentarily for a Linstroth report. Former Fulbright Scholar to Brazil, University, Oxford University. Not sure exactly what I think it's Oxford University. But I think I see the two interchangeable. Again, is the U.S. Federal Reserve, is it constitutional? Is the 16th Amendment constitutional? These are things that people like Anthony Sutton, Norman Dodd. There's a huge list of academics, politicians, again, that question this. And I guess really what you've got to do as a living human being, unless you are a robot, but I haven't met one that I could speak to yet, at least that I know of. That was a joke. What you need to be asking yourself really is, are some of these narratives that are played out globally, are they things that the U.S. Constitution would support? And if you're kind of leaning on the fence of, hey, we need to restructure that Constitution, and if you're certainly on the other side of the fence where you're saying the Constitution shouldn't be applying to the human race in 2020 and it should be done away with, then I would urge you to reflect on the fact that what has that Constitution done for humanity since, 1783, 1786, that it was initially published? Because what it has done is it's enabled society in the United States to progress to really unparalleled achievements. Of course, this is my opinion, than any other race in the history of man. Perhaps arguably since the Greeks. I mean, we're looking at Socrates, Aristotle, some of these theoretical, philosophical approaches to living freely and justly in a liberous manner, democratically, if you will. So on one end, we are very fortunate to be living in this time. We have the freedoms to be a melting pot of all different types of languages, cultures, belief systems. And that's the beauty, right? That's the beauty of the United States and even the UK. And again, I kind of went off on this because you're looking at the UK and the US being, from what I'm understanding, 1 and 2 societies hit number 1 by the coronavirus death toll anyway. Yet those really are two of the 2 most free-thinking societies. Okay, so do you have a problem with a global shutdown? Do you have a problem with the Federal Reserve? Have you never thought about it? I'm urging you to think about it and question it. All right, so again, iantrottier.com, articles tab. Go to Barnes & Noble, Freedom Reserve, No More Lies, pre-order the book. Follow me on Twitter, follow me on Instagram, and we will usher in right now J.P. Linstroth. Stand by. COVID-19, Georgia, and a state of fear. What we'll be discussing. Again, counterpunch.org is typically where he publishes. Let's see what we got him here.
Hello?
JP.
Hey, Ian.
Good afternoon, sir. How are you?
Good. How are you?
Good. Are you still on lockdown?
Well, I mean, not really. I mean, our governor opened up some things, but it's not, total quarantine. I get out to get groceries and stuff and things like that. What about you?
We are gradually reopening. The city that I'm in, if you will, is slowly starting to wake up again. There's more traffic. There's more people in stores. The restaurants are now phasing in. There's what's interesting is JP in one of the locations that I went to yesterday, because I think Monday was the first day that the phase one of this reopening had started. There were sections of the restaurant that were accessible, so they'd been taped off per executive order of the governor. So, for instance, the bar had one place you could order, and there was another section where typically you could sit at. That was, you couldn't even stand by it. So, kind of interesting dynamics of how the restaurant was being told to operate and serve customers. This particular location had a food, so kind of a kitchen where a window where you could approach and order your sandwich. The other thing, JP, is that these large plexiglass barriers are being put up, and this is common at the grocery stores, but now these restaurants are accommodating this type of interaction. What are you finding as far as your retail purchasing goes in that regard?
Well, I mean, I'm able to go out and get takeout, and there's quite a bit of freedom. I guess my biggest worry, Ian, is that opening up the economy or opening up everything too soon, like what the governor in Georgia did. In Palm Beach County right now, we have 214 deaths, 3,390 cases of COVID-19. In the state of Florida, there's about 1,500 deaths and about 37,000 cases. But as far as like one's ability to go out and do things, it's not really restricted. I mean, the beaches are closed. Pretty much, it's Miami-Dade, Broward, and Palm Beach County that have the most cases, and so because of that, we have more areas which are closed, service industries which are closed, than other parts of the state, which I'm totally fine with, because I think my worry is that we're going to have a resurgence in cases.
Right.
And it's just the way that diseases go. And if you know anything about epidemiology, which I know a little bit about because I took a course in it, and you know that you can have a resurgence in cases like Hong Kong did, or really what happened in San Francisco with the influenza outbreak in 1918. I guess the Florida Governor DeSantis, saying that people are being tested. The other thing is that the government is not really testing enough people. And also, I just want to iterate again. Thanks for having me on your show. One of the things that crops up to me, Ian, and one of the things I was thinking about last night, and I think that this is some of the things you've been touching on, is the founder of my college at Oxford, Wilson College at Oxford. His name is Sir Isaiah Berlin. It's the idea of freedom, right? The idea of liberty. The idea that that liberty can be curtailed, and can it be abused, in the sense that Isaiah Berlin talks about two types of liberty: negative liberty and positive liberty. And negative liberty is the idea that the absence of obstacles, barriers, or constraints one has negative liberties to the extent that the actions are available to one in a negative sense. Positive liberty is the possibility of acting or the fact of acting in such a way as to take the control of one's life and realize one's fundamental purposes. While negative liberty is usually attributed to individual agents, positive liberty is sometimes attributed to collectivity. And the idea is that you're able to do things free from interference, right? That's negative liberty. Like for example, like when we talk about freedom from interference in religious practice or freedom from interference in the press, right? That would be negative liberty. Positive liberty is the sense that you're able to do. It's kind of more of an internalized notion of freedom. And I think that those kind of concepts are important for people to realize their own kind of liberty and freedom, especially if it's being curtailed by government or how it's justified and so on. But, you know, I think that in the case of this coronavirus, you have the idea of the social good, right? What is altruistic? And some people aren't wearing masks, and some people aren't social distancing. And that's happening in Brazil. In Brazil, they're really having a bad time, Ian. Like, where I did my field work in Manaus, Brazil, which is the whole city is like a favela. The whole city is like a slum. They're expected to have 4,500 deaths this month alone. The whole healthcare system there is about to collapse. So the question here in the United States is whether or not if states continue to open, and Donald Trump is not even talking about the disease anymore. As a matter of fact, he stopped talking about it. He stopped having people like Fauci on. He just wants to talk about the economy, which in many ways is to save his presidency. But I think it could really backfire here because the disease hasn't stopped. I mean, the war isn't over, right? We haven't defeated this thing yet. It's not like, hey, you know, we're above the curve and we're plateauing. And no, I mean, I think people have rightly pointed out that we're still peaking in the United States. So on the one hand, you know, we can talk about, you know, liberties being curtailed, but we can also talk about the positive good. And the positive good is not to spread the disease more than it needs to be. The idea of wearing a mask or the idea of social distancing or the idea of quarantining is that you might not have the symptoms of being infected, but you know, the idea of the social distancing or the quarantining is that you're not going to infect others because you might be carrying without knowing it. And so if we're allowing people to, you know, to do things and to not pay attention to the social distancing, it has a potential of not only resurging but becoming worse. And we know this to be the case for history of looking at diseases and so on. We also know, like in countries like in the developing world, there's no possibility for people in the developing world to social distance. Or if we look at places like in the Amazon estate, 43% of the population there doesn't have access to running water. There's no way to wash their hands. If you're living in a slum, you're not social distancing because you're overcrowded. You're in an overcrowded situation. And this is a humanitarian crisis that's going to be ongoing, unfortunately. And We haven't really seen the worst of it in the developing world. But when I look at places like Amazonas State in Brazil, it's certainly heading toward a humanitarian crisis of unprecedented scale. And I just wrote an article about what's happening with the Indians there. The Brazilian Indians, Brazilian Amerindians, we're talking about a genocide at a scale that has not been seen for 500 years, right? The diseases that wiped them out 500 years ago when the Europeans first contacted those people with smallpox and chickenpox and measles and influenza, wiping out as many as 90% of the population in the Americas when the Europeans contacted them there. And at least in South America, we're looking at they had wiped out 56 million people by these diseases. Now that the disease is spreading like wildfire in Brazil, and one of the things that anthropologists like myself are worried about is that you have illegal loggers and illegal gold miners invading indigenous territories, which basically has been allowed by the Brazilian president Jair Bolsonaro.
Yeah.
And because of those invasions, Ian, they're spreading coronavirus. And, I mean, people, there's no realization that that's going on there, but we're talking about a humanitarian crisis that nobody's seen in their lifetime. And these people have been affected by diseases in the past. You know, when roads are being built, or you know, the Yanomami people in northern Brazil and Venezuela having been affected by a measles outbreak, almost wiping out, you know, a majority of people of the Yanomami, and also other peoples, wiping out a majority of those people because of roads being built and so on, bringing a disease that they had no immunity to.
Yeah.
So I don't know if you read the article that I wrote about comparing the governor opening up too soon with the human sacrifice.
Yeah.
Of course, that was, I mean, a complete exaggeration, right? And my mom was like, "Well, it's a little bit too far." Well, the point was that either, you know, knowingly or unwittingly allowing people to die. Like, what is acceptable? What is acceptable? Why is it acceptable for, like, the Lieutenant Governor, Patrick, to say that, yeah, it's okay to sacrifice older people for the economy? Where does that mentality come from? Like, why is it acceptable to sacrifice people for the economy? And I guess that's what worries me enough, you know,
Yeah, that's a Tucker Carlson, at least per your article, Texas Lieutenant Governor Dan Patrick. Again, this is a special, and I thank you for coming on, joining the program earlier than normal. I've got slated for the what I've seen, JP, since this pandemic is broken. I've actually seen more. I've had for a couple of years now in a UK link, but this afternoon I'm actually bringing on a columnist out of Dublin, John Waters, who is currently taking the High Court there in Ireland, taking them to court with someone named Gemma O'Doherty. And the challenge is kind of how you opened up with your angle this afternoon, as far as, you know, what is freedom and what type of parameters should be put on freedom. So anyway, so to isolate what he is doing in Dublin right now, and again, he's joining the program at the 4:15 mark, and then I'll be having on Oxford lecturer, Dermaid McCullough. He's a gay theologian that left the Church of England because of how he was being treated as a gay man. So we'll totally shift discussion, not that normal 5 o'clock hour. And as you know, for a few months I've been working on the remote access. So what we're doing right now is the remote broadcast, and then I'll be in a studio because I've found an alternative where I'm at when I'm outside of Miami, and I'll have those two gentlemen from the UK join. So anyway, we've got certainly. You're making, and it's almost a catch-22, right, JP? It's almost a catch-22. It's here. You've got a virus. It's deadly. If you've got a weak immune system and you can't fight it off, then you're more susceptible to of course, having it end your life. That's just the way. I mean, it's the same thing with any virus, I would think, really. But there again, what are the social parameters? Some of these remarks that have come out recently, and I haven't heard this one from the Texas Lieutenant Governor about sacrificing elderly people for the good of the next generation. I don't think any individual should be sacrificed. That seems to be extensive. But I don't know if what in your view, JP. Again, I use the term catch-22. In your view, how are you approaching it? Are you choosing to wear a mask when you go out? If you have gone out, are you supporting those that don't want to wear a mask? Are you not supporting that because you feel like you could catch? They could be carrying, not knowing, and you could catch the virus. How have you approached it personally, JP? And then, what is your thought in regards to? And we'll get into this a little more at the 4 o'clock hour with John Waters. And of course, he's simply a pundit, really, in that he's not a legally trained person. He's simply a columnist in that regard, but he is fighting for what he feels are his rights and other people's rights. But again, I equate it to that phrase catch-22 because here we've got something that is a deadly pathogen. It is killing people. You've got from Manaus, I believe it is. You've sent a photograph of a mass grave. So there's, and we've got, like you're saying, these indigenous people that are not able to have the hygienical practices that a more developed country can. They can't wash their hands. They can't go out and buy sanitizers. They can't use fresh masks. So there's lots of different kind of angles to be looking at here.
Right. My view, Ian, is that look, I believe in freedom, right? And I believe in what Isaiah Berlin, who's really a remarkable political philosopher, at his two ideas of liberty, two concepts of liberty: negative liberty and positive liberty. The idea that of negative liberty, the absence of obstacles, barriers, constraints, or interference on the individuals is what he's getting at as far as negative liberty. In other words, you're free to practice your religion free from interference, right? Or you have freedom of speech free from interference, as opposed to the idea of positive liberty, which is presence of something like a control, self-mastery, self-determination, self-realization. However, where I draw the distinction is in this type of disease that you may have those freedoms, but you're not free to harm me, right?
Right.
You have a freedom, but you don't have the freedom to hurt other people. And my view that the idea that people are not social distancing, are not wearing masks when they can and they should, and if they're not, they're causing undue harm. I mean, the fact that this man was killed in this store recently because he was asked by, I guess it was a security guard, to wear a mask. The guy didn't want to wear a mask, and then he killed the security guy.
Wow.
That's just ridiculous and insane.
Where did this
People
happen,
are
JP?
insane. This happened in the U.S. I don't remember what state it was. It was Texas. But
Wow.
it did happen somewhere in the U.S. This was recently. This was a couple of days ago. You have this kind of insanity that crises brings out in people, but also you have a inherent goodness as well. So you have the kind of extreme. But you may have freedom, but you don't have the freedom to harm me, right?
Right.
If you're not practicing, I mean, it's one thing to be in a developing world and you're not able to wash your hands because you don't have running water, or you're not able to social distance because you live in overcrowded housing. That's one thing, but it's another thing if you're living in the United States, in a developed country, where you do have the ability to social distance, have a mask, and especially if you're in the middle class or have an socioeconomic status. Now there are people in the United States living in poverty situations, especially African Americans and Hispanic Americans, who, because of overcrowded housing, live in situations where they can't social distance. And I wrote about that as well. But that's another thing. But I mean, you go to the supermarket, you should be wearing a mask. You should be social distancing. I don't understand why people are not doing that. And I certainly understand the right to freedom and the right to liberty. I just explained, through the, Isaiah Berlin. But I at the same time, you shouldn't be causing undue harm. That's what I'm saying. And you don't have the freedom to cause undue harm or spread the disease as you see fit, just because you don't understand the disease, right? I mean, that's my point of view. I mean, because I think that, I see these protesters in Michigan wearing their guns.
Yeah.
And, some of these ridiculous kind of opening up the economy thing. I just find it really egregiously stupid. And so I just find it really unfortunate.
What are you finding, JP? Go ahead. Sorry.
Yeah. Sorry, I just wanted to bring up where the man was killed. There was a Michigan security guard killed in the mask dispute. That's what it said.
Michigan.
So that's.
What are you finding, JP? What are you finding the approach in your classes at the various institutions that you're lecturing at? What are you finding in the younger generation? So let's say the college age, undergraduate age. Is there a common theme in regards to how they're identifying liberty through this COVID-19? Are you able to draw any type of understanding or conclusion from that generation?
It's a good question. Like I haven't really posed that to them. Probably should, but with the kids that I teach, and also, adult learners. I mean, it's totally different groups, but I think one of the things that that's been brought up, at least my nieces are seniors in high school, they won't get a graduation ceremony this year. A lot of all of that has been curtailed this year. Things are canceled. The questions are what's going to happen in the fall. I mean, even where I teach in the high school where I teach, is it going to, we're going to have classes in the fall? Is it going to continue with the online learning? What I find is that, well, obviously students don't want to work, so that's pretty normal, right? But as far as their understanding of freedom, I don't think they have any concept of it, really. They just don't. I mean, they're young, and that's fine, and so that's okay, But when you become an adult, it's no excuse to not understand the idea of undue harm, and it's not even altruistic, right? Social altruism is like, you're doing something for the good of the community as a whole. But when we're talking about disease, which is a deadly disease, it's not even altruism because, okay, yes, you're wearing a mask for the good of the whole, or you're social distancing for the good of the whole community. But I think it goes beyond that and it goes back to this idea of not doing undue harm to others, right? And if it can be prevented, then you should be doing it, right? You should be wearing a mask. You should be practicing social distance for the reason that you're not going to cause somebody next to you undue harm. And I look at my parents. My mom's been self-isolating for the last couple, 6 weeks, a couple months now. And she wants to continue doing that. And she's in the age bracket where it's worrisome.
Right.
But this disease is taking people who are younger as well. It's taking children. It's taking any age, every age group. And so, one of the I didn't talk about this really yet, but I've been recently interviewing Buddhist monks, Ian, for my book. My book, which hopefully will be coming out soon. I'm trying to get it finished by the summer. It's called Crises Beyond Nationalities, essays on racism, immigration, genocide, peace, and love. That kind of. I mean, the title hasn't been worked out because the publisher is still trying to negotiate the title. But I've been interviewing Buddhist monks, and the reason why I've been interviewing them is because I discuss in the book a lot of difficult subjects on, terrorism and violence and genocide, and I wanted to end on the notion of peace, right? And one of the things I like about Buddhism is this idea of self-awareness, right? The idea of mindfulness, right? This is a Buddhist concept. You're mindful not only of yourself and what you're doing, but others around you, right? And I think this gets to this idea of not doing others harm, right? And I think that this plays into that. And, mindfulness has become an important concept in education. But the idea of being aware of yourself, wherever you're at, aware of your actions, and mindful of others, you have an obligation of an individual, if you're living in a community, to not harm others, right? We have laws against that, right? And I think that even if you have the freedom not to wear a mask, or even if you have a freedom not to social distance, let's say, I still think that, because that you have a potential, we talk about action potential, a potential of causing harm, then you should wear one. I mean, I know that others have talked about it. It's like people, will berate you like, hey, why aren't you wearing a mask? And like, what with preventing you from wearing a mask. I mean, I haven't personally seen that, but I've heard others talk about, like, if somebody goes into the supermarket without wearing a mask, they get, talked to by others. Now, there are stores here in Florida, and stores that I go to, they won't let you in the store without wearing a mask. And, there's a county ordinance, and I'm sure Miami-Dade, where you were before, has the same thing, which, strongly urges you to wear a mask and strongly urges you to practice social distancing.
Yeah.
And so that's my view. And I just the idea of undue harm, right? I think that I believe in liberty. I believe in negative liberty. I believe in the positive aspects of it. And I especially believe in negative liberty. That you should be free from any barriers to do what you really want to do. However, there are limits in the sense of causing others harm, right? That's my view on that.
Yeah, you end this article that we're kind of basing the discussion on Georgia and a State of Fear with a quote by Albert Camus, the book The Plague, 1947. No longer were there individual destinies, only a collective destiny made of plague and emotions shared by all. And that's we are all, whether we like it or not, we are all in this together. We are all breathing the same air before the pandemic hit and after the pandemic hit. Let me throw something at you, though, however, JP. And I like how you've kind of brought, and I don't get religious on the program and try to stay from politics, even though the politics is something addressed frequently just because of governance and the need for governance, like you had alluded to a few moments ago. You're talking about human sacrifice and some of these ancient civilizations, as we know, by fact, anthropological fact, these old cenotes, anyway, in Central America, these people were sacrificing, even like the Indiana Jones movie, right? They're sacrificing, taking the hearts out of these people, for whatever religious reasons they're doing it. You're equating it, and of course you're taking things to an extreme here. But this is an extreme time, so it is relevant. You're equating this ceremonial sacrifice to just as a snippet, this lieutenant governor's remark in Texas. But let me throw this at you. Just briefly. So there's, as you know, there's been an alternative attack, if you will, on Bill Gates and some of his remarks regarding vaccines and microchipping, and I'm sure you're aware of that and his efforts to curb the growth thereof of the pandemic and the virus, and to somewhat kind of try to harness it. Of course, he's coming from a computer background and how he can apply his expertise to it. But it is kind of it's symbolic of the day and age that we are living in. We are so dependent on internet for information exchange and communication exchange. So this is something that we have allowed into our societies globally. With that said, let's look at, for instance, I'm not sure if you're aware of this or not, but the coinciding with the cryptocurrency movement that is now well over a decade, maybe going on 2 decades, I'm not sure, and so now Microsoft has a world patent to run a cryptocurrency system off of mining microchipped human beings. Were you aware of that?
No, I was not. Sorry, I didn't know anything about that.
So it's JP.
I don't mean to cut it short. I think. Okay, so here's my worry, and like going tracking, okay? Trump's talked about, oh yeah, we're going to have all these tests, we're going to talk about tests. The only way from an epidemiological point of view that you're going to get a hold of this disease is through testing, right?
Right.
And the only way people are going to feel safe is through testing. And this was brought up last night in one of the new commentaries was brought up. We can do this, right? All these meat factories that have been ordered to stay open, the federal government could set up testing regimes and require that these meatpacking plants require testing of all their employees. Because, again, the idea of undue harm. Why aren't you doing this? And they're just allowed to open and they're not testing people? That's insane, Ian. It's totally irresponsible on the government's part to cause undue harm of workers who are forced to work in conditions that don't allow social distancing. And you're not testing people? Give me a break. So the only way this is going to work in a reasonable fashion,
right,
and in order to prevent social fear, a total anxiety, a breakdown of society, is that you need to have more tests done, and you need to have testing done in the workplace. So part of that can be just, having one of those temperature thermometers that you point at people and you take their temperature, with a laser kind of thing, right? You could do it that way. But testing has to be systematic, and it has to be done in such a way that, hey, I know that if I go to work, the guy next to me or the woman next to me doesn't have the disease, and I'm okay in my workplace, right?
Right.
Because otherwise, if you don't have a kind of testing regime that's set up, that you're going to have absolute fear in the workplace, and you're not going to have one of people go back to work. Now, there's the other side of this too, is that there are people that have to work and have to work all the time because they can't afford not to work. And what I'm talking
Correct.
about are the people that in lower socioeconomic conditions, and a lot of them are minorities who work in the service industry, who are either African American or Hispanic. And the reason why that those groups are more often than not being infected by the disease, because they are forced to work all the time in the service industries that are exposed to more people. So of course they're going to be more susceptible to the disease. So when we talk about African American community or the Hispanic community more susceptible to disease, well, the Hispanic community also, because they are as far as ethnic minorities go, are the group of the population with the least amount of health care of all the ethnic minorities in the United States. So there are socioeconomic factors here. But the only way this is going to work, the only way that we're going to get back to a sense of normalcy here, is to actually testing for the disease. Now, as far as tracking people and this whole idea of cryptocurrency and Bill Gates and everything, okay, I'm not aware of, that specifically, and to answer your question, I'm just not aware of that. Now, you probably could set up tracking of people, and people already have. There's a company in Canada, I think it's called Blue Dot or something like that, and they can track you through your cell phone and not give any identifying information, but just track people where they're gathering, right? And they can actually trace people through the airline, so where you're taking flights from to see the spread of the disease internationally and so on. And I should look this up so that I have the correct company, but in any event, tracking is available, and you can do it anonymously through cell phone tracking, right?
Right.
And so that's my view, that we're not going to get a hold of the disease unless we ramp up testing to the level that it needs to be. And I think that I think that's reasonable, and I think it's a reasonable expectation of the government to yeah, it's called Blue Dot. I was correct. Outbreak Risk Software. Blue Dot Global. That's what it's called. In any event, they're able to track people anonymously with cell phone information and also your airline flight information, right? And you can look it up. It's a company called Blue Dot. It's a Canadian company. But anyway, we have to, talk about the National Security Agency. They do that anyway.
Sure.
It's whether or not we have the NSA working with health officials. Now, the fact that Trump doesn't even want to talk about the health situation anymore, as if the disease is over, I find really worrisome. I find it irresponsible.
Well,
and
yeah.
Go ahead. Yeah, sure.
It's not, the disease is not going, like you're saying, this is not going to go anywhere. There's multiple forecasts that are saying it's only going to rebound, possibly more detrimentally, come fall. Is this simply a move with the warmer weather and whatnot? Is this simply a move for the Trump administration to put themselves in a better position for the election? You alluded to that. You suggested that. He's not Fauci. I haven't seen Fauci giving his remarks, and we know that there's a connection to one of your alma maters there with Fauci. What is the purpose here for Trump to be blocking out this pandemic? I mean, people are still dying from this thing. This is still a very much a risk. Is there another motive, JP, in your view, other than an election move? Is there another reason that Donald Trump is now seemingly blocking out the fact that this pandemic is still a serious matter, or even exists?
I mean, I think it has everything to do with the election. I think it has everything with him getting elected, and obviously, we knew this before COVID-19 happened. The coronavirus happened. We knew that he would be running on the economy, and now with the economy getting to unemployment levels, we're at 20% now, at least. With our self-induced coma we put the economy in.
Right.
He's doing it because he thinks that by opening up states and by having an economic opening plan, that the economy is going to rebound all of a sudden. And all of a sudden, everything's going to go back to normal. Well, it's a complete fictional myth. And what I find egregious about it is that he's playing with human lives. We're already at least 70,000 deaths confirmed from the coronavirus. Well, we're well over the 1 million mark of people infected. And I just find it totally egregious that, okay, now the disease is over, as if we have won, as if we're in the decline. One of the commentators was watching last night. Yeah, New York is in the decline, but the rest of the country's not yet. And now that states like Georgia and other ones, this is not Georgia either, it's Texas, it's go around the country. There's some states that never even quarantined people, right? That never even had those rules in place. And, I find it really incredible that state governors talk about, well, we've never really had the disease, and it's not so bad here, and the number of cases we have aren't so bad. Well, that's a complete non-starter and nonsense, because the reason why you have as many cases is because you have a lower population. The disease hasn't changed, right? Just because you have a lower population doesn't mean you're going to have per capita as many people dying and being infected. You will. And so there's the economic argument that, well, we need to let the economy go, we need to open it up, regardless of how many people will die, is just a non-starter. The only way you're going to get a hold of this disease and to overcome the disease is to know where it is, and that's through testing. That's the only way in. It's not that hard. And one of the public health officials, she's at Harvard. Her name is Marcia Castro. She's a professor of public health at Harvard University. And, she talked about prevention. You need to have prevention measures in place so you can prepare for the worst. And otherwise, you're going to have what's called in public health is the fire brigade approach. You're just going to go and put out fires, you're going to keep putting out fires, but you're not preventing. You're not in the prevention mode. We need to think about opening up the economy safely. And the other thing is that Trump is ignoring his own guidelines, the guidelines that his administration put in place. That what are the safe levels that need to be, what are the thresholds that need to be met for states to open up the economy? Well, he's not even following that anymore. And so, it's just ridiculous, to be honest. I mean, I don't know how else to put it.
Yeah, there's something, in my view, JP. There's something really murky in the water. I think most listeners and most people that are kind of looking at both sides of the situation, there's something very murky in the water in DC. And it's, of course, now it's kind of it's hit home with most of us, and certainly those of us who have relatives or parents, loved ones that are again, and it is attacking people of all ages, but it seems that those with a weaker immune system are more susceptible. There's a local store here where employees are being tested. I think it's a Walgreens, and then there's a grocery store, and employees are unable to work unless they have. I think they're testing the temperature, the temperature, the body temperature. So if they have what's considered a temperature, then they're not permitted to work that day. And that's definitely something that needs to be implemented. Why not? But then there's also the other catch there, in that they could be they could have the virus and just not developed that temperature yet, or develop symptoms yet, and yet they're permitted to work. So it's this kind of, again, I keep typically using this catch-22, whereas what do you do? I mean, at the end of the day, my view on it, JP, is, well, if you feel like you might be putting yourself in line of catching the virus, then don't put yourself in that position. But then, hey, you touch that doorknob, and it's just like any other virus. And this, of course, seemingly is airborne. But whether you get too close to that person, or you touch that doorknob or the shopping cart, it's a pandemic, and we're all affected by it globally. There's no way around it. I would think one of the, and this is what for me, JP, is so disgusting to see what's going on in DC. In that you got to tackle it, and you've got to cooperate and not divide. There's got to be union, and we're not seeing that. We're not seeing that now. Trump is totally turning it seems like a blind eye to it. Or a deaf ear, and I don't use those
Well,
lightly.
let's look at the guidelines that his administration set in place. And this is people like Fauci and Dr. Deborah Birx, okay, Dr. Anthony Fauci. These are the guidelines that the Trump administration put out in mid-April, okay? We're talking a couple of weeks ago, 3 weeks ago, okay? These are their own guidelines that they put out, Ian, that now they're all thrown out the window.
Right.
Okay? To expedite the opening up the economy. So the guidelines, before phase one, okay, there's 3 phases of opening up the economy. And this is what the Trump administration put out, okay? A downward trajectory of documented COVID-19 cases within a 14-day period, and there's no downward trend right now.
Right.
A robust testing program should be put in place for at-risk healthcare workers. A downward trajectory of influenza-like illnesses reported within a 14-day period. That's not happening. A hospital is having enough protective gear for their workers and enough beds, ventilators, and other needed supplies to treat all patients. Not happening. Plans in place to protect essential workers and inform the public about social distancing and face coverings. Not happening. Okay? That's before phase one. So there's no downward trend as far as I've seen around the country. Now, New York is downward trending, but because the governor Cuomo's put in a regime of getting a hold of the disease. Okay, let's look at phase one. This affects certain employers differently. Schools and organized youth activities that are currently closed, such as daycare, should remain closed. Bars also should remain closed. Larger venues such as movie theaters, churches, ballparks, and arenas can operate, but under strict distancing protocols. Gyms can also reopen and elective surgeries can resume, phase one. On an individual level, vulnerable individuals such as elderly and those underlying health conditions should continue to shelter in place. Individuals who do go out should avoid socializing in groups of more than 10 people in places that don't provide appropriate social distancing, physical distancing. Non-essential travel is discouraged. That's phase one. But we haven't even done anything that leads to phase one. That's the thing that I'm saying, Ian, is that there's no downward trajectory of COVID-19 across the country. We're still peaking in a lot of states. There's no downward trajectory of influenza-like illnesses. Florida still has them, There aren't enough protective gear for employees, for hospitals, essential workers, enough beds, enough ventilators. You have to go through this state by state. What's phase two? Well, phase two says that, okay, the schools and daycares can reopen. Bars may be reopened, but leave less room for people to stand. Employers in phase two are asked to continue to encourage telework, working from home, right? For phase two for individuals, people are encouraged to maximize social distancing. Travel could resume. All vulnerable individuals should continue to shelter in place. Phase three, which is the last phase, vulnerable individuals can resume going out in public but should practice social distancing. Low-risk populations should continue minimizing time in crowded environments. Visit to senior care centers and hospitals also can resume, but frequent hand washing is encouraged. Employers can resume unrestricted staffing work sites. So those are the Trump guidelines that were put out mid-April, and now they're all out the window. It's like, okay, we're done with this because we've already, spent enough time sheltering in place. And according to whom? Not according to the epidemiologists, not according to the scientists. No, just because the economy needs to reopen. Well, like going back to this lieutenant governor in Texas, I think that if people had a choice over their life or the economy, people are going to choose to live, right? I mean, it's not even a choice. Anyway, I think that needs to be looked at really carefully. And I think that the idea of returning to some kind of normalcy, everybody wants to return to normalcy, including myself, including everybody. I mean, to be able to go to a restaurant and sit in a restaurant again, or go to a movie or whatever, or go to church or whatever people want to do, or go to the beach or wherever it is. But I just think that knowing how deadly this disease is and knowing how fast it spreads, I think that, it's too soon. And I think that, and so voices like Anthony Fauci are being quashed. They're not being heard. Deborah Birx was sitting in the room with Trump when he made the comments over disinfectant and using a light, and the only thing she said, well, that's not a treatment method. Well, why didn't she say that would cause death or suicide? You had a spike in cases about people drinking disinfectant after that.
Right.
So I don't know. I mean, the whole thing's just.
Yeah.
What do you think about it? I mean, it's just. I don't know. You think about this, but you put out these guidelines and then you totally ignore them.
Right.
Because they're inconvenient. Ian. That's what it is. So.
Well, it was as if he was doing that to appease, to appease a sector of perhaps. I'm not sure. I believe, JP. There's some real turmoil in DC. I believe it's driven economically, economic differences. I've got Gerald Posner joining the program next month. He's written 3 New York Times bestsellers, a former Wall Street attorney, and he's just totally attacking the pharmaceutical industry. But there again, that's another debate. I mean, we need medicine, but then is corruption so deep within some of these pharmaceuticals that literally they are not having a problem sacrificing your grandmother or your loved one to put money in their pocket. Not to
right.
the human sacrifice thing, but we've got definite issues in this country. This is on a global scale here. This pandemic, something that you and I don't believe have seen during our lifetime, and my sum is nothing other than it's a catch-22. You go one way, there's a downside to it. You go another way, there's a downside. So I'm not exactly sure how to suggest playing this out, other than to dig deep into what may be spoiling some of these democratic values due to an economic benefit. That's really where I kind of looking at, it's just
I don't think it's catch-22, Ian. I mean, you do something, and if you don't do it, then you're damned either way. But I think there's some clear choices here, and the clear choices, in my view, are pretty simple, right? You open up the economy too soon.
Yeah.
You have a resurgence in cases. Then you have a total public fear and panic.
Right.
Because you have a resurgence in cases. Then you have a worse economic situation than before, when you were mitigating and preventing the disease to be spreading. Now you're in a worse economic situation because you opened up everything too soon. The disease has spread even more widely so. Because honestly, it only takes one person, and then that one person um, affects four others, let's say, and then those four others affect four others each, and it just grows exponentially like that. That's how disease works. This disease doesn't care about your socioeconomic situation. This disease doesn't care about your race. This disease doesn't care about your country of origin. It's a disease. It latches on to a host, and the ideal host. It'll latch onto the ideal host, whether it's a non-human animal or an animal, and now people are talking about it was a zoonotic situation of it began in the wet market in Wuhan.
Yeah.
We couldn't even figure out the origins of it because the Chinese sanitized the market so that when the WHO went in to investigate, they couldn't do anything because they already sanitized the market.
Interesting.
Now, one of the things that needs to be brought up is the environment. And this goes back to Native Americans who I study and and I write about, is that when you destroy the environment, when you cause undue harm, let's say, to the environment, you have a situation when you're causing more diseases. For example, malaria, right? Malaria is able to thrive when environments are more destroyed, and other diseases are able to spread easier when you're destroying the environment. One of the Buddhist monks that I interviewed, he said that he believes that the disease spread because of a lack of human compassion and love in the world.
Mm-hmm.
Well, on the face value, you can say, okay, that's kind of nonsense, right? However, if you really think about it, and I had to think about it for a little while. If you look at what happens in these wet markets, that you're literally torturing these animals. They're in stressful situations. They're going to be sick. They know that they're going to die. They're watching other animals get slaughtered and killed. So that's the situation where, let's say, the disease develops in a wet market.
Wow.
It's passed zoonotically from one animal to the next. These animals are stressed. They get sick. They're passing a virus from one to another because they're in very stressful situations. That's not compassion. That's not love. This is what we're doing to the environment. This is what we're doing to animals.
Yeah.
We need to learn the lesson. And Native Americans, by the way, Native peoples have been talking about this for years. We need to live sustainably with our environment. We need to live sustainably in our means and not think that it's okay to destroy everything and live in this consumer society which we live in without living sustainably, Ian. I think that's another point that needs to be brought up.
Incredible point there, JP. Wow, nice insert. JP, we've got to wind down. I've got John Waters coming on at the 4:00 hour. That was a real nice insert, JP. And again, you can find JP's work at counterpunch.org. And his focus typically is on the Amazonian indigenous people, which are completely under fire and under attack right now. We are all in this together, regardless of language spoken, cultural practices. This is all of us. This is a human race issue, and at the end of it all, it's all about peace. And I'm going to say, JP, it's all about caring for your neighbor, your brother or sister, regardless of their walk, how they walk through life. That's what it's all about for me. But I want to get some closing thoughts from you, JP, as we round out our time together this Wednesday.
Yeah, I've been thinking about, and I thank you, Ian. I just want to thank you again for inviting me on your show again. I think the idea of going back to what you just said just now on love and peace, and I think that when humans endeavor to be caring, and I think that love is one of the highest forms of human achievement as far as this idea of being altruistically caring to others and not causing undue harm is one of humans' highest achievements. And going back to Albert Camus, who wrote The Plague back in 1947, and obviously about a pandemic or epidemic, when he said, "No longer were individual destinies, only a collective destiny made of plague and emotions shared by all." And like you said, we're all in this together. It's not that difficult to wear a mask. It's not that difficult to social distance. We have to think that, yes, the economy might not open anytime soon, but that's better than dying. And hopefully that, and maybe it's a lot to hope for, our elected officials will figure out that people need more to sustain themselves, that we need a national health care system. This is obvious that you need a coordinated national federal healthcare system. It can't be just states determining by themselves what to do when we have a pandemic, and we're bound to have another if we're treating the environment the way we do. We're bound to have another if we're allowing wet markets in Wuhan or wherever they exist, and we trade in animals and we abuse animals and we abuse our environment. We're bound to have more of these pandemics. We're bound to have repercussions from our environment. And Noam Chomsky, recently he's quite old right now, but he's talking about the existential threats to humanity. Well, the existential threats to humanity are the way that are the environmental threat, right? Not getting a hold of this, and also the nuclear weapons, right? We're closer to the midnight clock, right, which is the doomsday clock, than we've ever been.
Yeah,
we need to get a hold of these things. We're smart enough. We're smart enough as a species to do it, Ian. And I just think that this COVID-19 disease has brought out the economic disparities and the health disparities. It's obvious that I think it's become obvious that the reason why African Americans and Hispanic Americans are so susceptible to this a disease like this is because of socioeconomic reasons. The reason why, and also Native Americans and indigenous people are susceptible. They don't have the immune system. By the way, Native Americans in this country, last point about that, is they're not even getting any funding. They're dying at a higher per capita rate than most other countries. The Navajo Nation is really suffering. They're supposed to get $8 billion going to native lands in this country, going to all the Indian reservations. They've not received any federal money yet, Ian. None. So there's a lot of things to bring up. But anyway, I just want to say that, yes, we're all in this together. Let's just not cause any undue harm. And of course, there are individual liberties to consider, but not at the harm of the community, right?
Yeah, that's actually a great segue, because you're looking at the successes that this country has had. It's quite deplorable, in my view, that there's not even a healthcare system to treat everyone. And next week we'll be having on author Den Bishop that will be discussing his view on healthcare reform. JP, lots of great stuff here. I hope it gives listeners something to think about and act. And most importantly, most importantly, JP and I both, not to speak for you, but I'll speak for you because I feel you're probably on the same note. We're both giving our time and various research and opinions to do just that. For you as listener to do something and act, and that's the only way that we can move forward in a collective way and to live more civilly and unified. Is that if these discussions cause listeners to do something and act. JP, thanks for joining the program. Looking forward to bringing you back on, and sounds like that book you're writing is dynamite.
No, I really appreciate it, Ian, and it's wonderful always to be on your show, and thank you very much. You can find what I write on Counterpunch and also on academia.edu, and I just hope that the message does get out there, like you're saying, that we're all in this together. We all want. We don't want more deaths. We don't want more people being infected, and I think that we have to take into consideration, things we're doing with the environment, things that we're doing that allow us for a pandemic like this. And I think that those are bigger questions too. And as a country, are we prepared and so on? But again, thank you so much, Ian, and I wish you well and good luck with future guests and so on. And always great to be on your show.
Ladies and gentlemen, JP Linstroth. JP, until next time.
Take care.
So, again, JP does have a PhD from Oxford. He's a former Fulbright Scholar to Brazil. And you can catch his work at various outlets, but that would include counterpunch.org. Yes, Den Bishop, president of Holmes, Murphy & Associates, HM&A, is one of the largest employer-owned, controlled insurance brokers in the United States. Quote, the intent of the book isn't to pretend to solve America's healthcare cost, coverage, and complexity issues. It's also not intended to sway readers to either the left or the right politically. The healthcare issue is neither blue nor red. It's purple. It's an all-in combination of blue and red because it impacts each and every one of us without regard to race, religion, income, gender, or politics. And that comes from the author himself. He's a graduate of Southern Methodist University, earning a degree in business administration, healthcare reform is the title of the book. He'll be joining the program next week. That's May 13th. Later on this month, we'll be hosting native of Bergen, New Jersey, James Edward O'Keefe. Earned his Bachelor of Arts in Philosophy from Rutgers University in 2006. He's got some very controversial postings. He runs Project Veritas. He is also the author of American Pravda, My Fight for Truth in the Era of Fake News. Why is this a reality in the United States? Why is it? Why is fake news a reality? Well, one very easy answer for that, because freedom of press is not being upheld. In my view, because media outlets have been bought out by greedy corporations, corporate-minded folks, that is not keeping it free. It's causing it to become biased. Okay. StopMassMedia.com gives a graph from a Swiss organization, and it shows you in the past 40 years just how consolidated ownership of American media companies have become. From, for instance, 80 major owners and network owners to just as recently, I think, of 5 or past 6 years to 6. Going from 80 to 6, that means a more monopolizing ownership of the way you and I and everyone else in this country receives their news. That should be alarming to you. And yes, we're going to be opening up next month with Gerald Posner. He's an investigative journalist, author, and former Wall Street attorney, a native of San Francisco, California. Posner has a Phi Beta Kappa. Was Phi Beta Kappa and summa cum laude, graduate of the University of California, Berkeley. Was also a national debating champion at that time, winning the Micheljan Award. Posner went on to receive his Juris Doctorate from UC Hastings at Cal Berkeley. He'll be joining and talking about his book, Pharma, Greed, Lies, and the Poisoning of America. And again, the end game here for all of us, I'm hoping for you, should be to collectively create and continue this environment of peace. And I'm going to tack on love and harmony. There's nothing nicer in life, really, than laying your head down at the pillow on the end of the day and knowing that you've done something good for humanity to make it a more peaceful environment. In my view, that is the end game. I'm going to continue before I sign off here. And again, catch me at the 4 o'clock hour this afternoon. I'll be hosting John Waters, fighting for your rights if you're in Ireland. June 17th, recently added. June 17th, Crisis of Character. Gary J. Byrne, a former Secret Service uniformed division officer. He served in federal law enforcement for nearly 30 years in the U.S. Air Force Security Police and Uniformed Division and Secret Service, and most recently as a federal air marshal. In his book, #1 New York Times bestseller, Crisis of Character, he shared his experiences as the first Secret Service employee compelled to testify in a criminal case against the sitting U.S. president. That would be Bill Clinton. A White House Secret Service officer discloses his firsthand experience with Hillary, Bill, and how they operate. That's coming from Gary J. Byrne. He'll be joining the program June 17th. Folks, again, catch me at iantrottier.com. Click on the articles tab. All right. I do this because I feel that there is deep corruption in the way that the United States is governed, and only you can change that. And I do this because, again, of another health pandemic, or epidemic, not pandemic, epidemic. Well, maybe it was pandemic. It started in Brazil. The Zika virus and the pesticide used against it. Very controversial. Look, I inadvertently started that road, and it's led me to here. Book coming out, was to be coming out, it should have been published, but because of the COVID-19, I believe it's been pushed back to July. I mentioned at the start of the program. Freedom Reserved, No More Lies, publisher trying day. All right, this has been Linstroth Report. JP Linstroth, he is signed off. Spread the message, share it with a friend, share it with a family member, a coworker, whatever it may be. Only you can make a difference, folks. Until the 4 o'clock hour with John Waters, if you do nothing else with your time, then simply be awesome.